And welcome to the Health and Social Services meeting for February 8th. Would you call the roll, please? And thank you. Is there any declarations of pecuniary interest from any members in attendance? Seeing none, hearing none. Adoption of the minutes from January 11th. Councillor Brenner, second by Councillor Dyes. Any questions? All in favor? And that is carried. I'm going to move over. We have no statutory public meetings, and I'm going to ask for our presentation from Strengthening Public Health. Dr. Kyle, would you like to introduce?
So thank you, Chair. So pleased that some colleagues from the Office of the Chief Medical Officer of Health can be present to acquaint the committee to an important public health initiative at the ministry level, strengthening public health. And who we have from the Office of the Chief Medical Officer of Health includes Liz Walker, who is the Executive Director of that office, Brent Feeney and Colleen Kyle. And I'll turn it back to you, Chair, and they will walk committee through their deck and acquaint committee to this important initiative.
Thank you very much, Dr. Kyle. And I believe, Liz Walker, you'll be leading us.
Good morning. Thank you very much. And yes, I'm happy to start us off, and then Colleen and Brent will walk through some of the slides. Just one last check that you can hear me okay?
Yes, we can. Clear.
Wonderful. Thank you. Okay, so really, I just first of all wanted to start by thanking you for having us here this morning, to Dr. Kyle for the invitation, and to the board for making the time for us this morning. We do have a short presentation. We will run through the slides quickly, which will just give you a bit of an overview of the three streams that are part of the public health strengthening work. And then very happy to leave time for some questions for us at the end. Anything that you'd like to ask of us, or comments that you'd like to make towards the presentation, we would very much welcome. So I will turn it over to Colleen. I think we'll start. Colleen, are you? There she is. So I'm going to turn my things off. Thank you.
Thank you very much, and thank you for the opportunity to join you today. So the Strengthening Public Health initiative was announced in August by Minister Jones at the AMO conference. So we're going to tell you a little bit about that today. For context, the work is really stemming from recognition of longstanding challenges within the public health sector, mostly related to capacity, stability, and sustainability. Which has had implications for health outcomes and equitable health outcomes across the province that a number of reports have identified over the past 2 decades. So since the SARS pandemic in 2003, there have been a series of reports that have consistently called for strengthening public health, certainly in some different ways and at different times, but mostly focused on those elements of capacity, critical mass, some structural governance challenges, and skills gaps in boards of health, as well as some misalignment of public health with other parts of the health and social service system. The COVID-19 pandemic certainly reinforced for all of us the critical importance of a robust public health sector, with some key lessons, including the importance of local public health agencies having sufficient capacity to respond in a crisis situation, as well as the benefit of collaboration across the healthcare system, and the need for stability and sustainability to be able to respond to ongoing and future challenges. What the Strengthening Public Health strategy aims to achieve is to optimize those elements of capacity, stability, and sustainability, and to deliver more equitable health outcomes for Ontarians. So the four identified outcomes are to clarify and refine public health roles and responsibilities, to result in stronger connections to and relationships with our key health system partners, including Ontario health teams, primary care, and other parts of the system. Core public health functions being performed either locally, regionally, or provincially, informed by a prioritization framework. Reduced variability in the prioritization and decision-making and communications, especially during crisis situations, while still remaining responsive to local needs. There's a desire for a system with fewer local public health agencies, but with greater capacity to deliver core public health services, along with better alignment with the broader health system structures. And so for reference, as many of you are likely aware, we currently have 34 local public health agencies in the province. Stability for the sector and sustainability in funding for the longer term to support planning and consistency, as well as more equitable program and service delivery. And finally, improved frontline programs and services for Ontarians at the local level. The strategy is a sector-driven, three-pronged approach that's aiming to optimize these elements of capacity, stability, and sustainability. So we're focusing on roles and responsibilities, an approach on voluntary mergers, and funding. I'm going to tell you a little bit. We're going to talk a little bit about that, and then we can take some questions. In terms of roles and responsibilities, the focus is on clarifying and strengthening the role of local public health by refining, refocusing, and potentially re-leveling some roles and responsibilities. So as part of this work, we are conducting a routine and sector-driven review of the Ontario Public Health Standards, which is our policy direction to the sector, using a prioritization framework. Sector engagement is just getting started on this work, so folks at the local public health agencies will be engaged as we move forward. Working with partners to identify roles that could be potentially refined, maybe stopped, or re-leveled to potentially be delivered at a regional or provincial level, or better supported at the provincial level. We are aiming to implement the revisions to the OPHS beginning in January of 2025. So this current calendar year is a heavy year for working on this stream. I think Brent Feeney is going to take us through the mergers and the funding pieces now, so I'll hand over to him.
Thanks, Colleen. Good morning, everyone. So the second important pillar of our strengthening public health strategy is voluntary mergers. And through this, we're hoping to optimize capacity by encouraging mergers between local public health agencies through a time-limited, voluntary, sector-driven process. And the key here really is voluntary, and it's quite different than the approach that was announced by the province back in 2019 through the 2019 Ontario budget. If some of you may recall, back in 2019, the province announced that it would be reducing the number of local public health agencies from 34 to 10, and there would be a provincial savings target of approximately $200 million. Based on the advice and input we received from both the public health and municipal sectors, this revised strengthening public health approach is quite different. And on the voluntary merger piece, it is voluntary. So there's been a lot of work done since the minister announced this approach in August. We've undertook a comprehensive engagement strategy with local public health agencies, the municipal sector through AMO, and provincial stakeholders, and we've done that throughout the fall. We've designed a process for voluntary mergers, including outcomes and objectives, which was released to the field in October. And then in December, we launched a process for local public health units to submit business cases, and those are due in April. The plan at this time is to have mergers, those mergers that are approved and that come forward, to take effect January 1st, 2025. So this overall strategy does come with provincial funding investments, and the province has committed to provide 3-year funding to local public health agencies that addresses the urgent need for stabilization while change processes are underway. Those funding commitments include, we are restoring the provincial base funding to the level previously provided under the 2020 cost share formula. Total for the province is approximately $47 million. I believe for Durham Region, it was approximately $50,000-$60,000, and that's going to become effective January 1st, 2020. As some of you may recall, back in 2020, the province changed the cost sharing arrangements, and $47 million in total funding was adjusted from the base funding of public health units. So we are restoring that funding back. So the funding that was reduced is going to be restored. There's also a commitment to provide growth-based funding of 1% over the next 3 calendar years. So all health units will receive an across-the-board 1% increase. For Durham Region, that equates to about $300,000 annually in additional base funding. And we've also established a dedicated 3-year merger support fund to support this change. So for those health units that are approved for mergers, the province has committed to fund 100% of eligible merger transition costs. So there is no financial implications for the local public health agencies and municipalities. So a 3-year commitment from the province is a first of its kind. Typically, as some of you know, the province tends to do funding commitments on a year-to-year basis. So we're quite pleased that we're able to provide a 3-year commitment to support health units in their planning. And while all of this work is underway, the review of the standards, the voluntary mergers, we have committed to undertake a review of the ministry's funding methodology for public health, looking at the longer-term base funding needs of local public health agencies to ensure a more sustainable funding, predictable funding, and more equitable funding. So further information relating to that, to the review process, will be shared with the field, including engagement will be shared with the field over the coming weeks and months. But the plan is to implement a new funding approach for public health effective January 1st, 2026. This slide just basically summarizes some of the timelines that we've already walked through in terms of the roles and responsibilities, and the plan is to implement a revised Ontario Public Health Standards in January 2025. As I mentioned, initiate the voluntary mergers by January 1st, 2025, and then on the funding is to implement a new funding approach effective January 1st, 2026. So again, we are committed to working in partnership with the municipal and public health sectors to maximize opportunities for local improvement and system impact. There has been a lot of engagement taking place already with AMO, with the Association of Local Public Health Agencies, with Medical Officers of Health, and we'll continue to work with the sector to find ways to better strengthen and improve the capacity of our public health sector. So again, really wanted to take the opportunity to thank you all for having us present today, and we're more than happy to open it up for any comments or questions that you may have.
Thank you very much for the presentation. Is there any questions? I don't see any in my speakers list. I do have a couple of questions. With the voluntary merger approach, have we already heard from agencies across the province of hurdles already that they would experience or are experiencing?
Yes. So we've had, and Liz and Colleen, please jump in if I'm not capturing this fully, but yeah, so we've had a very positive response. First, on the fact that this is a voluntary process. So we've had a lot of dialogue with a number of local public health agencies on the potential for mergers. There have been some, we've received a positive response, but yes, we have also heard some concerns. The concerns have really centered around timing. A lot of local public health agencies are a bit concerned about the timeline for submitting the business case as well as the timeline for implementation. So we've been working with those local public health agencies on mitigation strategies, and including we've extended the timeline and we're giving local health agencies a bit more time with their business case. There have been concerns raised about geography and the fact that, especially in the north, an amalgamation or a merger of local health units may result in quite the large geography, and we've tried to make it very clear that our intent with this process is not to impact service delivery at the local level, not to have impact on front line jobs, no impacts to where services are delivered. This is really a process to improve and increase capacity at the local public health unit level. It's not a provincial savings exercise, as we mentioned earlier, which is quite different than 2019. And we've also heard concerns about funding and what are the provincial municipal funding implications beyond the 3 years. And we've really tried to link that to the provincial funding review that we've committed to conduct and really look at, what are the longer term base funding needs of local health units. And we're hoping to address that through that funding review. So it's really been timing, geography, and funding. And I think I said this at the AMO conference. Right now, I think we've got about nine or so groupings of local public health agencies that have come forward with interest to merge. Doesn't necessarily mean they'll jump to the business case process, but they are exploring interest in merging, which we think is great.
Okay, I appreciate it, and thank you very much. I don't have any other questions from members of the committee, and thank you for your presentation today. Dr. Kyle, would you like to introduce the next presenter as well?
Yes, thanks, Chair. So I'm pleased to introduce Dr. Miriam Pazeshki. Miriam is the director of our Oral Health Division. It's been a while since committee has had an update with respect to our oral health programs and services. So I want to thank Miriam and her team for, one, their deck, and two, for Miriam to be here to just reacquaint you to some of our oral health programs and services. So thanks, Chair.
Thank you very much. And Doctor, please proceed with your presentation.
Thank you. Good morning. Thank you, Honorable Chair and members of the Health and Social Services Committee for the opportunity to receive our update on oral health programs and services. Oral health is integral to general health, but unfortunately, it's often not valued until someone becomes sick. Untreated caries in permanent teeth are the most common disease, affecting 35% of the global population. In Canada, cavities are extremely prevalent, with 96% of adults having experienced them. The incidence of dental caries differs among children and youths across various age groups. Oral health conditions have major impacts, with 2.26 million school days and 4.15 million working days lost annually due to dental issues. Tooth decay causes 1/3 of day surgeries in children aged 1 to 5. The Oral Health Division provides comprehensive dental care through services and programs such as treatment in the clinic, school screening, health promotion, and estimate and claim processing. At the clinic, we offer comprehensive dental care services to recipients of the Ontario Senior Dental Care Program and Healthy Smile Ontario at this time. The clinic, situated in the south of Oshawa, features 7 operatories and 1 dental lab. Dental professionals, including dentists, hygienists, dental assistants, and denturists, provide the services during weekdays. However, our capacity is limited, leading to challenges in delivering dental services promptly. We also collaborate with social services to offer dental care services to residents in regions of long-term care homes. The Ontario Senior Dental Care Program is a provincially funded initiative that provides free routine dental services to low-income seniors aged 65 and above. It is estimated that approximately 10,000 seniors in Durham region will be eligible for treatment under the program. The program was launched in December 2019. Oral Health Division continued to provide services throughout the COVID-19 pandemic, and the number of the patients receiving treatment in the clinic has increased over the last 3 years. In 2023, we served 2,016 unique clients across 7,421 appointments. Healthy Smile Ontario is a government-funded dental program that offers free dental routine care to the children and youth aged 17 and under from low-income households. We served 744 patients through this program in 2023. The Oral Health Clinic serves as a dental home for low-income families, offering a wide range of the comprehensive dental care services to eligible recipients. These services include, but not limited to, filling, extraction, dental, denture care, scaling, and root canals, and also urgent care. Our next program is a school screening. The Oral Health Division performs the school screening for elementary students to detect urgent dental needs. Data from screening and our clinic improve understanding of children and seniors' oral health in Durham region, guiding targeted health improvement program for most in need. In 2022-2023 school year, our dental screening program nearly doubled its reach, screening almost 45,000 children compared to almost 26,000 in 2018-2019. This increase was part of our post-pandemic catch-up strategy. Despite stable urgent need rates, detection of non-urgent needs nearly tripled. Our next program focuses on health promotion activities and initiatives. The Oral Health Division provides a health promotion program to boost awareness, access, and utilization of the publicly funded programs. It focuses on enhancing the oral health knowledge of children, seniors, and their guardians and caregivers. The 2023 health promotion activities included engagement with 38 schools, reaching almost 7,000 children and 473 teachers, providing training workshop for 45 long-term care home staff, and participation in 77 community events. Also, extensive use of social media for promotion and information sharing. The final but important service offered by Oral Health is the processing of the claims and estimate. The work involves two main components. The first is Ontario Work Adults, which offers basic dental coverage for OW adult recipients. Over the past 3 years, a decline in claims and payments has been noted, likely due to more private practices turning away OW clients. The second component covers Ontario Work discretionary benefits, accessible through two pathways. The first one is Employability Program, helps eligible OW clients who participate in an educational program aimed at securing employment. The second is Learning, Earning, and Parenting Program, aims at young parents aged 16 to 25 on OW who have yet to earn their high school diploma. Under this program, we processed 96 claims amounting about $28,000, also marking a decrease from the previous years. The estimate process we offer helps private practices in assisting OW clients with treatment not covered by basic coverage, including multiple extraction and dentures. We processed almost 2,000 estimates, leading to only 782 approved claims worth about $547,000. This outcome may be attributed to various factors, including a shortage of providers willing to offer dental care services to Ontario Work recipients. One of the primary challenges have been faced, particularly with the patient in need, is the inequality in access to oral health care, including in Durham region. Access to oral health care disparities in Canada mainly stem from insufficient public investment in dental services and insurance gap. In 2022, the private sector spent approximately $70.7 billion on dental services, compared to the public sector's that was $1.1 billion. There are marked disparities in dental insurance coverage among different communities, provinces, income levels, and immigration status. This insurance gap restricts access to oral health care, with 35% of Canadians lacking dental insurance in 2022. However, the issue is more acute for seniors, as over half of them lack insurance, necessitating them to pay out of their pocket for the cost of the services. Limited access to publicly funded dental programs is also a contributing factor. Health Canada notes that only 5% of Canadians use oral health services through these public avenues. Alarmingly, over 1/3 of Canadians haven't seen a dental professional in last year, with almost 25% avoiding visit due to the cost. To enhance access to oral health care services, the government introduced a new initiative called the Canada Dental Care Plan, called CDCP, which aimed at reducing financial barriers for Canadian residents whose annual adjusted family net income is below $90,000. The application process began in phases, starting with seniors in December 2023. Eligible seniors will be invited to enroll by May 2024, while adults with disability tax credit certificate and children under 18 can apply online from June 2024. The application opens for all other eligible Canadian residents in 2025. Providers may register this month with services for seniors 65 plus starting in May 2024. Details on fees, covered services, and payment process are pending government finalization and announcement. Considering the current challenges and upcoming new program, as I mentioned, CDCP, we have identified several strategies to continue serving patients in need and to enhance access to care throughout the region. Our future considerations include collaboration with Brock Community Health Center, expanding our geographical reach, extending our office hours, and expanding our screening program. Furthermore, we will maintain our collaboration with social services to support residents of long-term care homes and also Ontario Work recipients. In conclusion, we are committed to navigating the challenges ahead and embracing new opportunities to ensure comprehensive and equitable oral health care access across the region. Thank you for your continued support as we work together to improve the oral health of our community. Thank you. I'm now open to any question you might have.
Thank you very much, Dr. Paschke. We have Mayor Foster. Mayor Foster, do you want to hit speak again? Okay.
Can you hear me now?
There you go.
Oh, perfect. Thank you. Doctor, for looking at our seniors program, I'm reading you've got 7 chairs. You call it an operatory or something. You did over 7,000 procedures. You were speaking to capacity issues. If I were a senior and had to book something today, how long would the wait typically be?
It depends on the nature of the problem. If it is something urgent that we have to see the patient immediately, normally we do our best to accommodate and see the patient in a couple of days at the most. However, sometimes there are the not urgent needs, the elective needs or denture care, then they should wait probably a few months until we can see them.
Okay, and again, if we're looking at the appointments, 22, you had just shy of 5,000 for, I'm reading it from the other screen here, 4,800 to 74. If you saw continued increases, you are going to be overwhelmed fairly quickly, no?
Yes, we are. We are, because the public demands and needs are high and our capacity is limited. Because of that, as I mentioned, in our future consideration is that we need to expand our infrastructure and also use the infrastructure that we have more efficiently. However, at this time, the number of the staff that we have is not enough to expand our office hours. If we wanted to expand office hours and include evening or even Saturday, we need to hire more staff. Yes, absolutely, you are right. It's going to be overwhelmed,
Okay,
and we need to have more infrastructure, more staffing, and also more dental clinic across the region. As I mentioned, we have only one dental clinic in south of Oshawa. We need to have one, for example, across in the east, west. We are going to start working with the Brock Community Health Center to improve access to care in the north. However, they have only 2 ops. And with the CDCP coming, and we don't know how it's going to impact the existing programs, most probably the public demand is going to be higher than now. Yes.
Yeah, Doctor, thank you ever so much. And
Thank you.
I guess at some point we look at staff and find how we best advocate to make sure that we get run over by so many buses. Wouldn't it be nice to be driving one for a change? Thank you. Thank you, Madam Chair.
Thank you.
You're welcome. Sometimes we get backed over as well.
Well, yes, either way, we're under the bus.
Any further questions? Doctor, thank you very much, and thank you to all the staff for
Thank you.
what you do for the services that are very important for our community. And as we know, oral health is very important to all of our health, and
Yes.
Too often we tend to think that it is not. But thank you for your work.
Yes, absolutely. Thank you. Thank you for having me.
Yeah. I'm going to call upon Lisa McIntosh to give introduction for our next speakers.
Hi. So I'm introducing today the managers from our OW program in the Income, Employment, and Homelessness Supports Division. So I have with me Erin Vallant, Devon Nation-Williams, and O'Neill McIntosh. Thank you.
Thank you very much, and welcome. Please go ahead.
So, good morning, honorable members. Hello, my name is Devon Nation-Williams. I'm an area manager with the Income, Employment, and Homelessness Support Division. And as mentioned, I am joined today with my colleagues Erin Vallant and O'Neill McIntosh, who are also area managers of the program. So this presentation is intended to provide a foundation of recent changes to the Ontario Works program, as well as an overview of Ontario Works rates over time. This presentation will include updates on progress of these initiatives. There are 3 items we would like to speak to today. Social Assistance Modernization is a provincial initiative that includes an update to the Ontario Works application process and employment services transformation. We will also share related impacts of these initiatives on the Ontario Works program. We will also highlight how provincial program funding has shifted as a result of these initiatives and provide an overview and history of Ontario Works rates and resulting impact on vulnerable residents. The Region of Durham has delegated authority under the Ontario Works Act to deliver the Ontario Works Social Assistance Program on behalf of the province. The Income, Employment, and Homelessness Support Division carries out this responsibility on behalf of the region. The region is responsible for the provision of financial assistance and benefits to OW clients, case management, and service navigation for nearly 13,000 people each month, and supports to help clients achieve employment. For 2018 and 2019, the province announced its intent to update and modernize assistance and employment assistance programs. The provincial government officially announced in 2020 its plan for a renewed social assistance system. The provincial vision is to create an efficient, effective, and streamlined social services system that focuses on people, providing them with a range of services and supports to respond to their unique needs and address barriers to success so they can move towards employment and independence. Social assistance renewal is a phased multi-year initiative resulting in significant changes to provincial and municipal roles for Ontario Works and Ontario Disability Support Program, or ODSP. Once implemented, the focus of municipal delivery partners shifts from eligibility determination and benefit administration to the provision of stability supports and service navigation. It is important to note that these program updates did not include any corresponding increases in funding for municipalities to operate the program. They also did not include any monthly benefit increases for clients.
So one of the components of social assistance modernization is the creation of a provincial application team. The intent of the province is to centralize the application process for Ontario Works and reduce the administrative work being done by municipalities. When the new model launched, the province expected to complete 70% of all Ontario Works applications. This efficiency would then allow municipal staff to have more time to focus on person-centered stability supports and case management for clients. The Region of Durham was an early adopter and participated to support the implementation of this new application process. The region was able to use its local intake and application model to align with this new centralized approach. And although progress has been made, this process is still underway and not yet completed. To date, the application target of 70% has not been achieved, and the anticipated reduction of municipal administrative work has not yet been realized. In 2023, regional staff completed more than 60% of applications and continue to perform administrative tasks for all Ontario Works applications, as applications granted in this new model are still required to have verification completed by the municipality. Considerable staffing resources continue to be allocated to support the workload associated with Ontario Works applications. The experience of the resident has also been impacted. The application process is often now a two-step process, requiring the applicant to share their story multiple times with multiple people at the provincial and local level. This can cause confusion for the client regarding who the main point of contact is or where the application is in the process. Many applicants are also now waiting long periods of time for an eligibility decision, and in 2023, only about half of all Durham Ontario Works applications were processed within 4 working days, which is the provincial service standard.
Good morning. So the Ontario Works application volume. So as mentioned on the previous slide, regional staff are still spending considerable time on administrative tasks required for Ontario Works applications. This is amplified by the increasing Ontario Works applications. The number of people applying for OW continues to increase, and in 2023, the application volume was higher than it has been in the last 10 years. There has also been a significant increase of new Canadians receiving and applying for OW in Durham. From 2022 to 2023, there was a 130% increase in Ontario Works applicants who have been in Canada for less than 3 years, and 220% increase in asylum claimants. Thank you. Employment Service Transformation, EST. The provincial government announced in 2019 that Ontario's employment services would be transformed to make it more efficient and responsive to job seeker needs. This new service delivery model integrates OW employment services into Employment Ontario and creates regional employment service system managers. The Region of Durham has dual roles in EST, as both an Ontario Works delivery agent responsible for assessing and referring social assistance recipients to Employment Ontario for assistance with employment activities, and as employment service system manager. Regarding Ontario Works, Durham Region OW was onboarded into EST as of January 1st, 2024. This means that employment service are no longer offered through OW. OW will now work with the Employment Ontario offices in the service system and the Regional Employment Service System Manager to support clients with employment assistance and finding, as well as maintaining employment. There is also a change in OW benefits through EST. Current OW employment-related benefits will no longer be available through the program. Clients will need to access Employment Ontario providers once referred for financial supports relating to employment. To To support the transition to the EST system, $4.5 million was transferred from our former OW budget to support the Employment Service Transformation System and benefits. The benefits will be administered differently under EST than they have been through OW. With Durham operating as both a system manager for employment services and also the social assistance administrator for OW, we are in an excellent position to identify gaps, address issues within the provincial guidelines from the ministries. We are also able to have staff actively participate at and inform provincial tables and networks with the full picture and impact of the changes to help with making the changes as smooth as possible for clients. EST also includes a new provincially designed common assessment tool and action plan. Both of these tools are mandated for use in the OW program. Some clients have expressed concerns regarding the complex and personal mental health and addiction sections of the CAT. It is important to note that these questions are mandatory and are to be asked verbatim. Adding to this challenge is that the tool should be administered within 30 days of entry into the OW program, which is often the first time the client is meeting with their caseworker. The CAT does not score, assess need, provide results, or match clients to services. Resulting shift in provincial funding. Ontario Works program delivery funding is required to be 50-50 cost shared between the province and the region. However, the provincial contribution has been frozen since 2018, and annually increasing staffing and operating costs have been absorbed by the region. As part of the employment services transformation, a portion of the funding that the region receives from the province to deliver the OW program will be transferred to the Ministry of Labor, Immigration, Training, and Skills Development and flowed back to the region as the Employment Services System Manager. The region's funding reduction in 2024 to deliver the OW program is 22%, or approximately $4.5 million. 2024 is considered a transition year, and there will not be any financial penalties to OW funding if targets are not met in the first year of implementation. Despite funding shifts, the Ontario Works program continues to be responsible to provide the same level of service for OW clients, as well as the addition of non-disabled adults receiving Ontario Disability Support, ODSP. The region, in its role as OW delivery agent, has always been required to meet provincial performance outcomes. The province has developed new performance outcomes that reflect accountability to support residents to achieve employment, including referrals to Employment Ontario and OW clients who exit the OW program for employment. Failure to achieve established targets can result in an up to 15% provincial funding reduction. It is important to note that many OW clients experience barriers to employment, including food and housing instability. And some also experience health concerns, including mental health and substance use challenges. These barriers can make it more challenging to pursue, achieve, and retain employment. In 2023, the number of exits from OW program for employment was less than 2% of all cases. Only a small portion, less than 10% per year, of OW recipients in Durham receive any employment income. Waitlists for health supports, including mental health and substance use programs to support people, can be lengthy, and the OW program is not able to directly provide these resources. The 2022 Social Services Ontario Works Client Experience Survey indicated that the top two challenges making it difficult for OW clients to find employment were mental health at 47% and physical health at 46%. However, the region has the distinct benefit of being both the Employment Service System Manager and OW Delivery Agent. These two roles will continue to work closely together to ensure positive outcomes for Ontario Works clients.
Again, it is important to note that Ontario Works rates have not been increased as a part of social assistance modernization. Rates for Ontario Works are set by the province and have been frozen at 2018 levels. Prior to this date, there were regular and annual increases as part of the program. People receiving OW as their primary source of income live below the low-income cutoff measure and are disproportionately impacted by the rapid rising costs of living and economic impacts of the pandemic. Currently, a single person receives a maximum of $390 for shelter and a maximum of $343 for basic needs. This total monthly entitlement for a single person relying on OW is $733, and this is to afford all monthly living expenses. In 2023, the Ontario Disability Support Program was updated by the provincial government to increase rates and tie rates to inflation on an annual basis. The earnings exemption for what ODSP recipients can earn while they are on the program was also increased to $200 to $1,000. This means that ODSP clients can now work and earn up to $1,000 before it impacts their ODSP entitlement. These changes were not mirrored for the Ontario Works program. Rates have not been tied to inflation and have not been raised since 2018. OW clients can work and earn only up to $200 before their OW entitlement begins to be clawed back.
So as highlighted by my colleague, Ontario Works rates have not increased and have not kept pace with increasing rental rates in Durham. The gap in unaffordability has continued to increase annually. The chart on this slide shows the difference between average market rent for both a bachelor and a one-bedroom unit compared to the Ontario Works shelter rate for a single person. Room rental rates are also increasingly unaffordable, and it is not uncommon for room rentals to be over $700 per month in Durham. We also know that economic challenges are disproportionately impacting our vulnerable residents by contributing to increasing income insecurity, housing unaffordability, homelessness, and food insecurity. It is important to note that people receiving Ontario Works are still more likely to be housed than they are to be homeless. However, that housing can often be precarious or unsuitable. Various strategies are often used by Ontario Works clients to afford housing, including sharing accommodations with friends or family, often in under-housed situations with more people living together than there are bedrooms. Living longer with family, receiving financial gifts from family to help afford housing, using other benefits, including the child tax benefit to offset increasing housing costs, or working to supplement their income. And as my colleague mentioned, Ontario Works clients can earn up to $200 a month while in receipt of Ontario Works before their monthly entitlement starts to get clawed back. Regarding Durham's Ontario Works caseload, in 2022, 88% of Ontario Works clients were renting. Approximately 5% of those were residing in subsidized housing. And in 2023, 85% of Ontario Works clients were renting, with 4% receiving some form of subsidy. Regarding clients who are homeless in Ontario Works, in 2022, 4% of Ontario Works clients had no fixed address, and that number increased in 2023 to 7%, which represents a fairly significant increase in housing instability and homelessness. Borders continue to stay at around 1% throughout the years. Currently, there is approximately 5% of the Ontario Works caseload that does not have a place to live or has not declared an address, and this includes refugee claimants and asylum seekers that are being supported through Durham's response program. And that is all for our presentation, and we are happy to take any questions. Thank you.
Thank you very much for your presentation. And I'll just know that I'll let the committee members know that under other business, there will be a motion coming forward on this as well to help to lobby to hopefully get some more money for our OW recipients especially. Any questions? I don't see any. Thank you very much. And thank you for all the work you do too. And we're going to move to delegations. Christine Voss is not here, but I'm going to call upon Megan McLeod. Megan, welcome. And Oak Ridges Hospice.
Thank you very much. Unfortunately, Christine couldn't be here today. She's got another appointment at the hospice, which she couldn't make it today. In recognition of Durham Region Hospice Awareness Day, which occurred on January 29th, I come to you today with an update on Oak Ridges Hospice, located in Port Perry. We are currently the only residential hospice in Durham Region, providing compassionate care and support to not only our residents, but to their families as well. I wanted to share with you today some statistics from 2023. We served 212 residents, resulting in 27 diversions from the emergency room and 24 after-hours admissions. This means we welcome people in the evenings and on weekends rather than go to the emergency room at the hospital. Being able to bring individuals to the hospice in the evening and on weekends is possible because we have our own intake coordinator. She lets families know that when they are ready, the Oak Ridges Hospice Morgan Institute House will be there to welcome them. We have an amazing network of staff and volunteers. We currently have 38 employees, in which 26 are clinical staff. This includes registered nurses, registered practical nurses, and personal support workers, whose experience and dedication ensure excellent support and care is provided to the families and their loved ones. Our favorite saying is, we allow families to be families again, relieving the stress of caring for a loved one in their end-of-life journey. We also have a dedicated crew of volunteers at Oak Ridges Hospice. We currently have 111 volunteers who, in 2023, provided approximately 9,875 hours of support to residents and their families. Our volunteers support us in all aspects of the hospice, from baking cookies for families in our kitchen to helping at fundraising events as well. We truly could not do what we do without them. I wanted to also highlight a few other things that we do. We are committed to the development of our community's healthcare system and increasing community awareness of hospice and palliative care. We encourage community physicians interested in providing palliative care to continue caring for their patients after being admitted to the hospice. We champion the development of future healthcare providers by providing mentorship to medical students working with our palliative physicians. We facilitate opportunities for those in their residency to develop a greater understanding and provision of palliative care in the community as they enter their career as a physician. Our boardroom at Oak Ridges Hospice and other common spaces are used by various medical groups to host meetings, support groups, and educational sessions. We are committed to the excellence and growth in our field and to our greater community as not only a service, but as an educational resource for hospice and palliative care. We are mentors and resources for other hospices in Ontario, including the Whitby Hospice, Roger Anderson House, and Marigold Hospice Care as they embark on their journeys. We also have grief and bereavement supports and services to help families and their loved ones deal with death and the life after their loved one has passed on. All of this while trying to fundraise almost 60% of our operational budget so families and their loved ones can access our services at absolutely no cost to them. Thank you for allowing me to speak with you today.
Thank you, Megan. Is there any questions? Mayor Foster.
Thank you, Madam Chair. Megan, and I don't know if you'd have this number off the top of your head. The percentage capacity, so the clients that you are seeing versus the number of clients that you could see, would you have any idea what that looks like?
Unfortunately, I wouldn't. That would be one of our intake coordinators' questions.
Okay, and my concern would be I've heard that the hospice could accommodate far more people. I don't know if that is true or not, and the fear would be whether the community is well aware enough of the services that you provide. So I'll maybe follow up with the hospice, or we've got a pretty good connection with Marigold here. I might do that. Thank you. Thank you, Madam Chair.
I just wanted to make note, we currently are a 10-bed hospice, and that's part of our initiatives right now is to try and bring as much awareness and engagement with our communities as we can to let them know that if they are ever in need of hospice and palliative care services, that we are fully open. We are willing to accept the full capacity of the 10 beds. We have the capabilities to support the 10 residents as well as their families as well.
Perfect. Thank you.
Thank you, Mayor Foster. Councillor Anderson.
Thank you, and thank you. I believe that my question was answered. I forgot how many beds the hospice had in.
Yes.
So you have a waiting, is there a waiting list or something like that?
We currently
How does it work?
We currently have a bed queue, so once our intake coordinator goes out and makes the first connection with the families and their loved ones as well, if they are not a total match to be admitted to hospice, they have a certain criteria they have to meet. If that person is almost at the criteria that can be admitted to hospice, they're placed on what we call a bed queue. And what happens then is our intake coordinator meets weekly, or she has a weekly phone call with the families or their loved ones as well, and she gauges the interest, and as soon as either the physician or she gauges that they're ready to be coming to hospice, they come to hospice.
Through the chair, you wouldn't know, how long is that queue?
I wouldn't know off the top of my head without looking at the database. I'm sorry.
All right. Okay. Thank you very much.
Thank you.
Thank you. And Councillor McDougall.
Thank you, through the chair. Thank you for the presentation, Megan. I have a couple questions, and just for framing purposes, my father passed from Jacob Creutzfeldt's disease, and he required palliative care. And at the time, there was no hospice in Durham, and it was a ward room for, I think, over 30 days at Lake Ridge Health Hospital, which he received fabulous care, but it was less than ideal for the end of life. My question is in terms of long-term stays, how long of a stay can a resident expect if they need a longer stay? Is that available at the hospice? Is that typical?
Yep. So our average length of stay right now is 7.7 days. Because of one of the criterias of being admitted to hospice is a palliative performance scale of 30%. Oftentimes what that means is that person is not able to get out of bed. It just depends on what the physician and what our intake coordinator gauges what they're at.
And so would lengths of stays in excess of a month or almost 2 months, would that be?
That's about average.
That's pretty normal?
Yep.
Okay. And then a question I have, and just in terms of funding,
Yep.
My assumption always was that if in our example, if my father had been at the hospice, my assumption was automatic that the funding from the LHIN that went to the hospital would automatically be steered to the hospice. Is that the case?
I believe so, but I'd have to double check with our fund development coordinator.
Through you, Madam Chair, is that a question that perhaps Dr. Kyle or someone else in the room might have an answer to?
Dr. Kyle?
Sorry, I can't.
We can get the answer and have it sent through an email
Yeah,
for
no
clarity.
worries. Thank you very much. Thank you for the presentation. Thanks
Thank
for
you.
what you do for the community. Thank you.
Any further questions? Megan, thank you for the presentation, and I'll share that in 2011 there was a feasibility study, and I'm not sure if you know about this feasibility study that was done for identification of hospice beds that were required within the region of Durham. But at that point in time with our population, it was identified that across the region that there was 6 hospices required with 10 beds. So that's a total of 60, and we only have 10 right now.
We currently only have 10 right now, with Marigold Hospice Care being slated to be built in the near future, as well as the Roger Anderson House. We're looking forward to working with those hospices as well.
Yeah, it's very important care, but it's also care that's not understood very well, because predominantly and families believe hospitals is the place where to go. But I think once we become more acquainted as to what the delivery of care, what hospices can do, it is one that I think there will be more and more of a support for it as well too. But thank you.
Absolutely. Thank you.
And we're moving forward to a portion of our agenda, which is within health. We have no correspondence, and we have one report. It's the Primary Care Outreach Program. Can I have a mover? Chair Henry, seconded by Councillor Anderson. Is there any questions on the report? Mayor Foster.
Yeah, thank you, Madam Chair. So I'm looking at page 5 of 11. This is table 1. And it's all quite striking. We live in a first world nation, but I'm looking at antipsychotic injections. So am I led to believe, and I'm going to exaggerate to make a point, that essentially we have professional staff going out and dealing with people who are having psychotic episodes and need these injections pretty much on the street, as opposed to facilities where they should be?
We have Jeff here, and I can have him answer that for you. Hold on, we'll get your mic in a minute. Your mic's not on yet.
There it is. Thank you. Through you, Madam Chair. Yes, that's a very good question. We do have paramedics who are going out and administering antipsychotic injections. It's not while they're actually in a psychotic episode, it's actually to prevent it. So the medication is given on a 14 or 28-day cycle, and they can't get the health care to get this, so it's preventative that we go out and give it to them.
Okay, but and again, we're looking at repurposing ambulances. To my mind, most of this stuff should be happening in appropriate facilities, again, as opposed to on the street. Would you agree with that? And I wonder how we got to this place.
I would agree with that, but we're doing the best that we can with what we have.
So that is not directed at you. I think that would be directed at the state of the healthcare system for what you are doing in exceptionally difficult circumstances. And let's talk about Band-Aid solutions. So, Madam Chair, thank you for this. But I really think we need to be telling members of the public what's going on out there. The vast majority of people haven't a clue, and the work that our staff are doing just phenomenal. Thank you. That's all that I have.
Thank you very much. Any further questions? I spent the Sunday with the PCOP team traveling through Whitby, Oshawa, and Ajax, and I have to say that the opportunity to have this report in front of us, but having a full understanding of the application of the work that is being done, I would actually encourage if members of the committee would take time, because it's actually very insightful to what is happening, and having great conversations with the paramedic and the social worker as well, and knowing what is happening across our community. And it was very educational for me, and I will be going out again as well too on a different day. But I not that I enjoyed, but it was very insightful to have that opportunity to spend some time with the PCOP team. And all in favor? And that's carried. Moving on to social services, we have no correspondence or reports. We're going to move to other business, and I'm going to ask the clerk to put the motion up, and we will need a motion to allow for introduction of this. Moved by Chair Henry, seconded by Councillor Brenner, and it is up. And I'm going to, all in favor? And I'm going to turn over, because I will be moving this motion. It's seconded by Councillor Dyes, and I will vacate the seat, but I will stay in the seat just to make things easier. And I'm going to turn it over to Councillor Dyes.
Sorry. So, Councillor Roy, would you like to read the motion?
Please. Whereas the region of Durham is one of the fastest growing communities in Ontario, and whereas Ontario Works financial assistance rates has been frozen since 2018, and economic challenges are disproportionately impacting our vulnerable residents by contributing to increasing income insecurity, housing unaffordability, homelessness, and food insecurity. And whereas a basic income program can ensure a comprehensive and inclusive approach to addressing income inequality and financial instability. And whereas Ontario Works recipients only have a $200 income exemption compared to $1,000 for recipients of Ontario Disability Support Program. And whereas improved financial stability would result in improved social, economic, and health outcomes for Durham's vulnerable residents, as well as increased opportunities for vulnerable residents to contribute to and invest in their local economies. And whereas social assistance modernization was introduced by the province with the intention to reduce municipal administrative burden to allow staff to focus efforts on providing intensive stability supports for vulnerable residents. And whereas administrative efficiencies for municipalities have not been realized under the social assistance modernization, and whereas the social assistance modernization program has had unintended consequences, including delays to processing applications and eliminating essential people-centered supports such as bus fare that are jeopardizing individuals' ability to move off of poverty. And whereas leadership is urgently needed from the provincial government to develop resource and implement a comprehensive and inclusive plan to address increasing levels of poverty for people living in Ontario, and particularly for those receiving Ontario Works. Now therefore be it resolved that the Region of Durham calls on the provincial government to urgently increase Ontario Works rates to livable rate and commit to indexing rates to inflation annually in line with the Ontario Disability Support Program, and further that the Ontario Works earning exemption be aligned with the Ontario Disability Support Program to allow individuals in the workforce to keep more of their earning and potentially encourage more participation in the workforce. That the Region of Durham calls on the provincial government to evaluate the effectiveness of social services modernization in consultation with municipal service managers, particularly with what extent the partial upload of the Ontario Works application process has resulted in streamlining efficiencies and maintain service standards. That the province ensure an adequate level of employment services funding is maintained by restoring funding within the Ontario Works program that was reduced as a result of the transfer of responsibility for employment services to the Ministry of Labour, Immigration, Training and Skills Development Service system managers, and that the copy of this motion be sent to the Minister of Children, Community and Social Services, Minister of Finance, Durham members of Provincial Parliament, the Association of Municipalities of Ontario, and the Ontario Municipal Social Services Association.
Thank you. Are there any questions on the motion? Yes, go ahead.
Thank you very much, Interim Chair, Acting Chair. I think this is a very powerful motion, and it is dead on. The current policy of the Government of Ontario is nothing short of systemic discrimination. The policy is such that it is denying opportunities for so many people to benefit from all the things that they deserve to benefit from. I wholeheartedly support this and ask for a recorded vote.
Thank you, Councillor Brenner. Anybody further? So I'd like to second the motion, and I just have a comment as well. I can't imagine, you know, we get a lot of concerns regarding the increased number of homeless. If you're getting $733 a month, you can make an extra $200. If you make over than that, you're penalized. How do you live on that? We've obviously, the province has not kept up with the population increase. We've not kept up with inflation, and now we're in a crisis. And we're expected to fix this problem for them, and it's not going to work until they start to address the issues financially. So I think this is a really great motion. Thank you for staff for putting that together and putting it forward. Mayor Roy, I appreciate that. So all in favor of the motion?
I'll start the recorded vote now.
Recorded vote? Thank you. We have quorum? Thank you.
Thank you, Councillor Dyes.
Back to you.
Thank you.
Madam Chair.
And I just want to turn to the staff at the back row there and to all the work that you do and stepping up, because we're always doing more than what we can do, and it's you're there to help, you're there to support, and we want to thank you very much for all you do for the most vulnerable residents of our community. Is there any other business? Motion to adjourn. Chair Henry, seconded. Nobody seconding? Councillor Anderson, you just like this committee so much? All in favor? Thanks.